Hi, I'm Dr. Leonard Karadimas at Advanced Orthopedics in Port Huron, Michigan, specializing in knee, hip, and shoulder surgery, arthroscopic and reconstructive. Here to talk to you today about shoulder problems. I do a lot of shoulder surgery. There are various problems that you can have with your shoulder that necessitate some type of surgical intervention. In today's day and age, it's typically arthroscopic. I'm here to talk to you today about rotator cuff tears, which are very common. I have a model right here of a shoulder, and it's basically a ball which is kind of hidden by some of the structures around here in a socket. The structures that you see around here are muscle and tendons, and the rotator cuff is actually a tendon that connects the muscle to the bone. What happens over time is that that tendon will begin to wear because of the surrounding bony structures. You get some wearing of this tendon, some pressure on it. Over time it wears, and then either traumatically or just wear and tear over time, you can get a tear or hole in that rotator cuff tendon. That'll cause people to have symptoms: night pain, weakness, general pain throughout the day, limited range of motion. Once that tendon tears, unfortunately, it will not heal up on its own. You can certainly try to cover it up or to make it feel better with therapy, steroid injections, anti-inflammatories, perhaps modifying your activities. But the only way to fix a torn rotator cuff tendon is to actually go in there and reattach it to where it's torn off of, and typically it's torn off of the bone. In today's day and age, these procedures, these surgeries are done arthroscopically. Arthroscopically meaning we use instruments that are just a little bit bigger than the tip of this pen, including a small camera and other instruments. What you do is you make little holes around the shoulder, typically 3, sometimes 4, go in there with the camera, and with the other instruments you can do the work. You can remove some of the bone spurs, you can clean out some of the arthritis, you find the rotator cuff tendon tear, you clean up the margins, and you reattach that tendon back down to the bone. Done all arthroscopically. In this particular model, it's hard to see it, but right there, I've demonstrated how you can repair these tendons. How do you reattach them to bone? Well, we have these nifty anchors that we have, much like this one right here. It's a small screw. It has suture attached to it. What you would do is arthroscopically insert the screw into the bone, pass these stitches that are attached to it through the tendon, and sew it back down to the bone. Sewing that tendon back down to the bone will stabilize it and over time allow it to heal. Traditionally, these were done with open incisions, and many folks still do that, but we do it here all through the scope, all arthroscopically, as an outpatient procedure. You go home the same day. It expedites recovery, makes it heal quicker, and certainly we get a great success rate with this. I do have a live surgery that I've done, an arthroscopic rotator cuff repair, and if you visit our website at advancedorthopedics.com, you can certainly see that. Thank you.